and better than normal. And she said, you no longer have to take it. And I didn't tell her that I didn't take it anyway.
Oh yeah, that's right.
I'm not telling anybody.
I ain't telling her. I ain't telling her.
Tell her so.
Yep.
So
Awesome.
you're no longer
Well, that is awesome. Sarita, just this come off mute, y'all. You know how we do it. Let's give her a hand. That's awesome.
indeed.
Every
That's
little
exactly
bit
right.
counts.
Okay, congratulations, congratulations.
Right.
Yeah.
Every bit.
Congratulations.
You know, Sarita, that also could have stopped you. Yeah, congratulations, congratulations.
And thank you,
Yes.
sir. I really appreciate it.
Yeah, because
testimony.
that stops you from moving you into the direction of taking a pharmaceutical drug.
There you go.
Got it?
That's exactly right.
And then when you get this pharmaceutical drugs, what they don't talk about is what's called antagonistic effects.
Mhm.
Antagonistic effects are when they have side effects. Each drug has a side effect.
Mhm.
And then when you mix them together, they have this thing called antagonistic effects. These are effects that they never even studied or researched about.
Yeah.
So they have no
Yeah.
clue what this is.
Yep.
That's why you don't want to get into that if you can't help it. That's why I try to do what you have to do naturally, organically. Let the body correct itself. We are the converters, right? We are the converters. We are the generators. We are the refiners.
Yes. Yes.
Never
yes.
stop letting your body do the work that it's supposed to do, because then you're going to be out of balance. So good stuff, y'all. Good stuff, Sarita. Thank you so much. Appreciate that.
Thank you.
That, see that
All
she was our sleuth, Dr. O.
That was the stealth bomber.
That was
right
stealth
there.
bomb.
She rolled in here. You know, I do have something I want to tell y'all.
Go ahead.
That was huge. That's huge. All right. We got Dr. Lenny was in here. I
saw him back there.
What's up, Dr. Lenny? Where is he? Is he still in, or is he left out?
No, he's there. He's there.
Let's get Dr. Lenny a hand, y'all.
That's right.
Hey,
That's right.
Dr. Lenny.
Dr. L, the man with the plan.
Yes. He's still at work. Look at him. That's dedication. Look at that. He's still at work.
Hey, Dr. Lenny.
Yeah, man.
Dr. Lenny, we so much appreciate you, man. And, you know, brother, you know, you do so much for so many people.
Yes.
And you know what? I got to say this, though, Doc. I have been enjoying watching online them doing chiropractic work on animals. I have really been enjoying this. Yes. They actually are doing chiropractic on the dogs. And like the dogs, they'll take the head and go click, and the dog looked at them like this.
He said, what?
I think that is the best thing, man. I mean, everybody needs it, Doc. Everybody needs it. You know,
it's great stuff. My boy Indy definitely got him going there back a while ago.
But, yep. You even he even adjusted Indy, my dog.
We were talking about you all this morning, Dr. Paul, at our team meeting, though, and talking about just finding people that are looking for what you were just talking about, and, you know, the alternatives to the medical model and the natural health care, what you're doing. So grateful for you and what you do. I always try and sponge up and learn from you on these calls, and people that you've sent in my office, very grateful for. Just some amazing, awesome people. And I appreciate you, what you do, and being on this journey together with you. I'm very blessed to know you, love you, and appreciate you, man.
Love you, man. Appreciate you, man.
Glad you love us like that, Dr. Lenny. Because we love you back.
You as well, my
Thank you back, man.
Yes, sir.
Thank you. Let's give him a hand, y'all. Let's give
Yeah.
Let's give him a hand. Come on, man.
Makes it all
Give him a
work,
shout
guys.
out. Make him feel
Excellent
love.
job. Lorraine the Pistons. She loves them.
See, and that's the family, guys. That's what we talk about. The family coming
That's
together
what's
all
up.
the way
That's
around.
what's up. That's what's up. Thanks, Doc. Appreciate you.
All right. All right, Doc. We got Tuetta go up in the corner. You want to
All right,
start
so
on
what
the
do we
chat?
have now? We can go with Summer. Is that
Yeah,
Summer?
with Summer. Summer, you there?
Okay.
Yep, I'm here.
All right. Go ahead.
Hey, Dr. Lenny, and happy birthday, early birthday, Big Bill. 81. Hope I look as good as you when I get 81.
Come on, girl. Come on now. Well. All right.
All right, Dr. Paul. Question. Two things. One, you had stated, I think it was a couple of weeks ago, that you were starting a teaching class or education class.
Mhm.
Has that started yet?
No, it's going to be
Okay.
online. I'm going to do it. I'm working on an online class. Yep, we're
Mhm.
doing
Okay.
an online class, and it's going to be 2 parts. And the 2 parts are those that want to just learn about a specific condition, whether
Mhm.
it's like diabetes, high blood pressure, cancer. You can
Mhm.
take a course. You can take a course, and then I will outline all the things like an assessment if you were coming in. But of course, it's general information of all the things that you need to be aware of.
Right.
See, they're not telling everybody what your options are. And if I would say the number one question that I get is people say, I wouldn't have done what I did if I
know that's
knew
right.
Yep.
this was another option.
Mm-hmm.
You know, that's
right.
the number one question. That's the number one compliment or
Mhm.
compliment, but also is comment that people will always say. And I say,
Mhm.
well, you know what? That's what it's all about. You can always still turn it around. So that's the one goal, is to do a class. The other one is to start to now bring more health practitioners into the profession. And that's
Mhm.
meaning that we're doing a certification. I want to do a certification because with, of course, you know that I came through Dr. Laila Africa, which is, of course, one of, just like you got Dr. Sabi, you have Dr.
Mhm.
Laila Africa.
Yes.
Well, we have the curriculum for that. But in addition to that, I'm adding to the additional curriculum with that. So the things that I have put to the equation is going to make it a dynamite package. And that's why we're going to say that's what we want to bring more people who really want
Mhm.
to talk about their health and maybe want to do something like a change career. I'll tell you, you got health is the biggest and booming thing you could ever
That's
want.
right.
Mhm.
I've been
So,
waiting for
uh,
this, Dr. Paul.
Yeah.
Absolutely.
Sign me
Yeah.
up.
I've been waiting.
Sign me up. Kay's waiting.
Yeah, because we need to take care of our families,
Mhm.
and there should be a health ambassador in everybody's family.
There you
And
go.
everybody on this
Exactly.
call,
Absolutely.
you can be a health ambassador to everybody in your family.
So
Yeah, be the strange one at the table.
I know that's
Saying,
right,
y'all
buddy.
know y'all need to put that pork down.
I love that.
You know
I
you need to
love
put-
that.
Yes. Yes.
My other question is about, I've heard you say use baking soda to clean, is it baking soda to clean your fruits and vegetables?
Mm-hmm.
Mhm.
So I just heard on the news today that they had a recall on strawberries because they found hepatitis in them.
Yep.
And how do you, when you say use baking soda, what do you mean? Do you mix it with water? Do you use baking soda by itself? Like, what do you do? Like, what's the formula for that? Should you
Mhm.
spray it?
Well, you would take your water, take a good water. Oh, we got a feedback. I got a feedback.
Yeah. Just get them on your side. There you go, Doc.
There it is, right there.
Pasta's ready. Your
All right.
greens
So what you would do is you would get a bowl of water,
heated up,
okay?
and
And
meat
you would
is
take
ready.
that bowl of water. Come on, mute yourself, family. If you're not speaking, please
There we
unmute
go.
yourself.
Done.
And what you would do is take the bowl, put in it based on how many that you're going to be cleaning. Of course, you want to take somewhere, start off with a tablespoon of just baking soda and put it in that Crystal Geyser water. And you bathe those, strawberries or whatever you have, blueberries or whatever, and just soak them in there for a little bit. Not to the degree where it loses its consistency. Got it?
Right.
Not too long, but enough that you can get off the pesticides and chemicals and things. When they test it all across the board of all those things that cleanse, it always wins baking soda, aluminum free. Got it?
Mm-hmm.
And they test it with things like even alkaline waters. They take it with vinegar, veggie wash, all those things. Every time baking soda wins. Now, why would that be? Why would that be? Does anybody know why baking soda would be the number one that cleanses that?
Because it binds to the what is it? Where they spray it. Yeah, it binds to right, the charge or whatever. The positive
Alkalinity,
charge or
magnesium.
something.
It's someone said, actually, I hear the answer sort of like in between, but yes, it means polarity and charge. Remember, bacteria, virus, fungus, sepsis, parasites all live in a positive charge. So with alkaline, it's a negative charge. And that's what baking soda is. It's highly alkaline. So what it does, it neutralizes acid. or anything that's in that positive charge. So it wipes it right off. That's why you can also take something like, you ever had a white shirt and you might have, something you nipped yourself or something. Men, you know what I'm talking about.
Yeah,
you might have
buddy.
a nice white shirt on.
Sometimes shaving.
Might have been shaving and you got the blood on your shirt. But do you know what's the number one thing to get blood out of your clothes? Anybody know what the number one thing to do is get blood out of your clothes? Anybody?
The bacon.
Peroxide.
That was a setup question. Y'all know it wasn't baking soda.
Yeah.
It was milk.
Peroxide.
Peroxide.
No, hydrogen peroxide.
Peroxide.
Because it's highly oxygen and highly hydrogen based. Remember, hydrogen based, high alkaline. It pulls it right off, and it's like magic. Comes right out. So what does that mean? That means that alkalinity is the key to all those things that clears off, that will clean all the pesticides and chemicals off of it. Now, I will say this, Summer, that does not include the latest thing, though. You remember the latest that I mentioned to y'all about a week or two ago about this new thing called Apeel?
Yeah.
Apeel. Write this down. Everybody write this down. Apeel. Apeel is the new spray that they're putting on all of the fruits and vegetables. They're trying to move this agenda, and this is to go not only on the conventionals, but they're trying to put it on the organics. Now, this is not good, y'all. This is not good, because this spray has these diglycerides in there. These are the things that they know when they were bragging about this new chemical, that this thing actually known to cause heart attack, strokes.
Wow. Oh, that's deep.
They know it. They were bragging about it, and then people were in the press conference saying, do y'all realize what y'all just said? That this is actually, you just named one of the toxic chemicals that causes heart attack, strokes, and a whole lot of other stuff. And the big Hollywood people are behind it. All right. Now, this is what I hated to hear, but yes, I got to put it out there. You got Bill Gates behind it. You got also Katy Perry, and we got our girl Oprah Winfrey is behind this.
Yes.
So that's why I say this is something that they've already known, that Apeel, you can't even put this, you can't even handle this. You're not supposed to even be touching this because it can be absorbed through your skin. This is the problem. This is a major problem. You know how many times you've been to the market and you picked up fruit and started picking it up just to feel it? I gotta see what's on there, right?
I know that's
How many
right.
times you feel fruit?
Why do they say they're doing
Why?
It's money.
Well, remember,
money.
it's being promoted as a way of preserving the fruit or vegetable longer. So they're starting with the avocados right now. So the avocados are the first one. And if you see the avocado, there is actually, matter of fact, there is a, let me see if I can show y'all. Y'all want to see this this logo that you'll be looking for?
Yes.
All right, let me show you what the logo looks like. So that you can
Doc, while you're setting that up, what's all comes to mind too. I bought some bananas just day before yesterday. Okay, and within 3 days they were brown. That's why they need this Apeel. You know what I mean? To keep it looking good for you guys. You think about that.
Yeah. See, they're pushing it
genetically
as a
modified
health.
stuff.
They're pushing it as a health, and that's the way you do it. You disguise it as something that's beneficial for you, but it's really not. Let me show you here. I'm gonna share my screen so you can see what it looks like here.
Diabolical. Evilness.
All right, there it is right
There
there.
you
You
go.
see
I
it
got
right
you.
there? See the symbol? That's the symbol right there. Now you're gonna see it on a lot of things. So you may see it on the avocados like this. See how it is? See this one right here? It says "Eat me." Oh God, these people are horrible. They're horrible. This is horrible. And look at the companies that are going to be in with this: Del Monte, Del Rey, Eco Farms, Sakar Farms, Beta. See, these got farms that are connected.
Yeah.
And
So it's going to come from everywhere.
It's going to be coming from everywhere. See all the stuff around here: asparagus, lemons, apples, avocados, apples. They're going to try to put everything with this. Be very careful,
Dr.
family.
Paul.
And one last thing before I go to you, they know that it does not wash off. You can scrub it and it will not come off. They've already
Wow.
determined that.
That's deep.
Already determined it. So
So,
be on the lookout.
so if you eat a piece of fruit like an avocado, you can, if you peel the skin off of it, are you okay? And with the fruit under it, or you can't even, it still seeps through into the fruit itself.
Yeah, remember the fruit in the vegetable has skin just like human skin. It breathes.
Exactly.
Mhm. Okay.
So I wouldn't mess with any of it.
Okay.
Because number one, you got to get to it before you, even if it's on the outside, you got to touch it, don't you?
Well, that's
I'm
true.
gonna wear gloves. I'm gonna wear. This product,
So
I'm
the
also
bacon
reading that
cleanses
this
it?
product causes allergic skin reaction and harmful, long-lasting effects to serious eye damage as well.
Yeah, absolutely. It causes all of that. You know, I did a show about 2 weeks ago. I talked about Appeal when it first came out. And it's just something that here we are again. You're sort of distracting people from, you're giving them a different angle and making it look like it's a health product when it's not a health product.
Mm-hmm.
You know, they'll give you, matter of fact, the sunshine, just like the bioengineered. Y'all remember the bioengineered, right?
Mhm.
Yes.
See how it looks like it's all happy? See all of it
Mhm.
happy? And then you have the things like bioengineered. Look, watch this. Bioengineered ingredients. See this one here? Look at this one. Got the sunshine on there. Making it look like you're bioengineering something and you're putting the sunshine out there. Oh, if I ever heard misrepresentation, I've never seen misrepresentation.
It looks
But
But
these are
that's
the
just
things you
like
got
the
to watch out.
pharmaceutical commercials. You're always in the field somewhere kicking up lilies when you take the medication.
Yeah, yeah. Well, remember what they're doing. They're trying to soften the fact that it's a deadly chemical. Remember, it's a poison. So that's why they try to soften it by using cartoon characters. You know, and then you notice that all the pharmaceuticals, they use some kind of cartoon characters, or, you know, it's always them coming outside of themselves, some kind of animation involved, you know. Remember the one where the guy, when the lady was sitting there and her stomach was following her around with digestive? You remember that one?
Uh-huh.
And
Yes, yes. Yes, I do.
remember the one where the turkey was driving? You remember the turkey was driving?
Yeah.
Yeah, he had a car, a home, he was fishing. It was like, yo, what are y'all doing? So again,
Oh yeah.
you know, these are things that you got to be careful of. All right.
Do they have to
So-
label it? Is it going to be on the labels?
It will be labeled. It will be called Appeal. That's what it's
Okay,
called.
all the labels. Okay, thank you.
So
Dr.
just
Ray.
watch it. Matter of fact, you got to watch before you touch now. You got to read before you touch now. Yeah.
The
Yeah.
baking soda will cleanse it?
No.
Nothing,
Remember, not the
nothing.
Appeal. The Appeal was not
Yes.
working with this one.
Oh,
Yeah.
my.
It's because it's absorbing. It's a chemical. It's a synthetic chemical that actually my dog is back here snoring.
But
Ain't that
Dr. Paul, they
something, boy?
legally
He
have to
is
show
knocked
that?
out.
Dr.
He is
Paul,
So what
knocked
should we
out.
do?
Like I
do they
said, don't
legally have
touch
to
it.
show that?
Don't touch it. What you can do to stay up on these things, go to the website Alliance for Natural Health. That's what I
Yeah.
would do.
There you
The
go.
Alliance for Natural Health. That's a good website that you can go to.
All over your floor.
You know, that's a good website that you can go to, and you can find out a lot of good information on what's happening and the health transparencies, you know, that are happening. Okay. So make sure you do go to their website. You can see if you want to get into the impact on the congressional level, that's the website. So if you want to make sure you can say something to your congressman or congresswoman, definitely that's where you would go. Got it? Alliance for Natural Health. They will keep you up to date on all of the latest and the greatest of what's going on. Matter of fact, I'm going to show y'all one more time for those who may have never seen the website. I'm going to show it to you. This is Alliance for Natural Health. You can sign up, join. Let me know when you see it.
Yeah, it's there.
Okay, see right here. They're calling it medical monopolies. You hit right here, join. When you hit join, you can go in, protect your family, register for the free pulse, put your email, zip code, hit to continue, and then you'll start to get regular updates on anything that's happening that you want to stay on top of. This will keep you and give you the 411 on everything going on. Now,
Thank
there's also what's called a take action button. See that take action button? That's the action center where you can go in, hit that action center, and it'll tell you all of the new cases of things that are going in real time right
Mhm.
now. These are the different ones that are happening right here. The FTC to complete ANH FOIA request, Freedom Information Act. Yep, Freedom Information Act. Here's the one, transparency on labeling and artificial sugars. Demand transparency with the mRNA vax. They going in, Brian. They going in. Congress letter to protect bioidentical hormones. See, they getting into stuff that will never make the media, but you're
Mhm.
going to see
Amen.
it on this website.
Yep.
So be a part of it. Hit the alerts. Find your legislation. You can find your legislation right here. You can put in your city, state, and then they'll tell you who your person you need to be contacting to send a letter. They even have a online email generated letter. All you got to do is sign your name at the bottom and hit the button, and it sends it on your behalf.
Well, okay now.
That's even better. Yeah.
Can't get no better than that.
So you can't beat that. Yeah, all good stuff. All right. Okay, let's move
So what are you
forward.
doing now for fruits and vegetables? What are you gonna do now?
What am I going to do? I'm not going to mess with an appeal. That's what I'm not going to do. Yeah, I'm not dealing with that. So what you got to do is stay on there, stay organic. Number 9. Got it? Wild time lasts. Also, start looking into getting your own gardens. You know, we had the whole piece with getting the heirloom seeds. Start storing up your seeds. Get your seeds going, family. Heirloom seeds. Remember, you want organic seeds and soils. Got it? Get your organic seeds and soils. Watch the Scotts brand. The Scotts brand is not one you want to be buying. You know, the Scotts brand is the brand that of the soil that's in Lowe's and Whole Foods. I mean, Home Depot and Lowe's. Yep. Don't get that one. That's the one that's the bad one. Okay, they modified that one. That's modified. So leave that one alone. All right, family. All right.
I need somebody to grow the food. I'll pay you. Who wants to grow your food?
What did you say, Bianca?
I said, does anybody on here want to grow food? I'll help. I'll pay you.
Yeah. How about this? And this is what I'm going to start doing. I'm going to put this out, and I want to put this out to anyone who knows farmers and those that be willing to do that, just like you just said, that be willing to start farmland, things like that. I would say, give me a call, give me their number. We need to start putting a farmers coalition together. I think that would be an awesome invite right now. And then we all participate as a co-op. How would the family treat you like that? I think
that would be wonderful.
I think that would be an awesome idea.
Absolutely.
I think that would be an awesome job.
That's a great
We
way
got to
to
get into
start.
that.
Make it
I'm
happen.
going to do that.
I would join it.
We create a co-op. I mean, there's 177, almost 200 of y'all on here right now.
That's right.
Yes, I think that would be good because we have to not only know how to, look at the times that we're living in, but we also have to start to know how to cultivate and keep these things. We got to know how to take care of it. You got to know how to plant. You got to know how to. We so used to going to the market and just picking up stuff that we may have did this a while back when your grandmothers and grandfathers used to plant little tomatoes in the back or something. We don't do it anymore. So that's why we got to start doing it. So let's get into that. All right. So if you got somebody, I want y'all to start. We're going to put a list together of farmers. How about that? All right. And then I'm going to have a meeting. We're going to get them all together and we're going to try to make a coalition going on here. How about that?
That would be great.
That'd be great. All right.
All right.
let's do it.
All right. Is that it, Summer? We go right to Karen. Is that it?
But Bill and Dr. Paul, just
Yes.
before we leave for that subject, this is Kamara.
Yes, I know.
Someone suggested that maybe when we go shopping, we need to put some surgical gloves on because of what Dr. Paul said. If you touch the item to pick it up to see if it has the label, now you had your hand on it.
Yeah, that's why I say
so
you
very
gotta
true.
watch. You gotta look before you do anything. Before you start handling, you gotta look. That's right.
And
That's
in
right.
order to look, sometimes you have to lift the product up and turn it
That's what
over.
I was
Yeah.
saying.
Yeah,
Get
that's
some
so very
gloves.
You
true.
gotta look, and you want to see if it's firm. You want to see if it's not, it's not tearing down. You don't want to make sure it's. You
Right.
just want to examine. That's just
It's some
natural.
Wear
That's natural.
gloves.
surgical gloves. Put some
Hey,
gloves
Ronnie,
on.
you got something, Ronnie?
Thank
I
you.
see you, Ronnie.
Yeah, I think maybe you might want to put a website on and title it the IHI, informativehealthinformation.com.
Okay, all right.
And anytime you need to find something out or something's on your mind about something you need to know about, you can apply and hopefully you can get some good information, correct information. You get what I'm saying?
Yeah, that's right.
Yes.
That's right.
Yes.
Information is power now.
That's the key.
Information is key. Information is power. And when you start to now in an age where information really determines whether you succeed or not, it's those that know and those that don't know that are going to make the difference. So let's get into that. So yes, let's start making this coalition. Let's get it together, y'all. I think it's a perfect time.
Yep. Simply said, God says, "My people perish for the lack of knowledge."
Mm-hmm.
And stop and think, Paul. All of it started on this call.
Yeah, there you go. There you go.
Anybody else know anything that is similar to what you experience like you do here?
I don't think so, Ronnie. You good, man. You're absolutely right. And the whole concept of this was based on the family tree concept, was
That's
from
right.
family, our ancestors. Let's get on a call and just talk.
Yep.
And that's why we got to hear each other out. I let people talk.
It's all about communication.
That's the name of the game, Ronnie.
That's right. That's right.
Yes, sir.
All
So
about
true.
And modern technology has made it so much easier than the past.
Yeah, there you
Yeah.
go. There you go. There you go.
Let's take
There you go.
advantage of it.
Yeah, that's right. All right, Ronnie. Thank you. Thank you,
That
cuz.
is so true. Dr. Paul, speaking of our children, my son is doing his own organic soil. So maybe
Right.
one day you can speak on how to. create
Oh,
your own.
absolutely. He's in the equation. Absolutely.
He's in his
Absolutely.
early
Please.
20s. I'm just blown.
Absolutely. Absolutely. The young folks are catching this faster than anything.
Most
If there's
definitely.
anything, that's what my son, when he did the documentary, we also showed a sort of a timeline of the men's gathering, the natural women's class, the classes at the Eagle's Nest. We showed all of these things and, from the footage that we had, and people were like, when was this going on? We were like,
Yeah,
"Yo,
that's so
we've
very
been
true.
doing
So very true.
a long time." And that we have to continue to have these programs so people can get the information so that they can make a better informed decision. You got it? So we gotta keep
Right.
it moving. All
And,
right.
just by dropping into my son too in 2020, we need to start growing our own food when the shelves were clearing off.
No doubt
Yeah,
about that.
yeah,
Start
yeah,
making-
yeah,
Growing
This
your,
is
your onions,
revolutionary.
peppers, your
yes.
onions and peppers in there. He called me one day, Mom, I'm doing onions, peppers, corn, bell peppers, just name it, rosemary, thyme. He just started growing his own in his
Mhm.
backyard. It was amazing.
All
how
right.
he just caught on to it. So it's like our ancestors.
So all the eyes say aye.
Ah,
Aye.
Farmers Coalition it is. We're gonna build this Farmers Coalition. Farmers Coalition.
that's exactly
All
right.
All right, we gotta get him. Now we gotta recruit.
There you
Now
go.
we gotta recruit.
That's exactly
All
right.
right.
All right.
All right. Who do we have next, Big B?
Go right to Karen now, because I think you're done, now, right, Summer? Okay, we'll go right to Karen now. Karen, there we go.
Yeah, good evening, everyone. Dr. Paul, have you ever heard of GAG?
reflex, GAG,
Gag reflex.
Gag reflex.
or pharyngeal reflex.
Yes, yes, absolutely. You got a lot of different variations of that. So what happened? What was specifically happened?
And that's what I have a friend that says, and the weird thing is only in the morning. I'm hearing
Hey, Ron, can you
TV.
mute yourself, Ronald?
Yeah, Ron, make sure you. Yeah. Is that him still on?
Yeah,
Let me
that's
mute him.
right.
I'll mute him. I got him.
Gotcha. Okay, go ahead.
Thank you.
Carol.
Got it.
Yeah, thank you. That's distracting. Yeah, the friend says that the weird thing is in the morning, early mornings, very early in the morning, like if she has to go to the airport or what have you. Whenever he came off mute again.
Yep.
Yo, Ron. He must think that he's not.
He's muted now. Go ahead.
Okay, I got him. Go ahead. Sorry about that, Karen.
Specifically early in the mornings, like if she has to go to the airport 4 or 5 in the morning or whatnot. But whenever she brushes her teeth, she cannot brush her teeth in the morning and go in the back to get to the back teeth. Because whenever that happens, she starts choking and gagging and all. So as she was mentioning that, I had never heard of, but I looked it up and started taking screenshots. I said, oh, that's a question for you.
Yeah, you're gonna have that happen sometimes. You ever been brushing your teeth and you go a little bit farther, you go like that. That happens. Yeah, it's part of, it's your body in a state of, you're trying to react to making sure nothing goes down into your throat. Yeah,
absolutely.
It's a reflex. That's exactly what it is.
Yeah,
it's a
everyone
reflex.
has
It's a
one.
protection. Yep, it's a protective reflex.
Yep.
And sometimes it's more active during the morning hours. So it's a protective. So it's not. Some people have it a little bit, maybe a bit more than others. They got to be careful going too deep back there. When you're going down the throat, you'll do it too. All you gotta do is put it back for far enough. You'll get it going.
Yeah.
well, the tongue, I understand the tongue going way back because that happens, but she specifically said the back teeth.
The back teeth?
The back teeth. And it only happens in early mornings.
Yeah, I would think she would start to investigate some other levels of watching the bacteria, because it only reacts when it believes that there's a threat. Reflex is like you're trying to stick something back there. I would start to do some gargling, things like Himalayan salt, things like salt waters, things like oil pulling. I would try all those different things. Make sure there's no bacteria issues involved there, because that's a little strange there. That's a little bit different. But like there is a gag, protection, as you would say,
right,
stop you from throwing something back there.
Well,
right,
yeah,
right.
Yeah. Good stuff.
Okay, I'll pass along that info, and then the last question I have is
that your arsenal back? Is that your arsenal back there?
Yeah, it is,
there, buddy. That's your arsenal back there.
That's some of the arsenal. Some of the arsenal.
That's some.
Light therapy belts. I don't, light. Can you do these help? This particular one is for back pain or lower back, or do they work?
Well, I mean, it's to each its own. Some people, they may get some reduced inflammation with those things. I would think it's each person's situation, depends on, what they're experiencing. Some people are having lower back issues that are a lot more severe than a light belt that can help it. So I think the most important thing that is giving you support of your back to keep it straight. That's probably one of the main things. But there's some, some people have shown some results from that. Maybe even, I don't know if Dr. Lenny is still in. Maybe he has
I don't see him. I think he may have.
Doc, do you ever see?
Oh yeah, he's there. Doc.
Dr. Lenny, you ever see the light therapy belts? You ever use those? Anybody
Yes,
ever use those?
We use those, Doc, for neuropathy patients to help stimulate angiogenesis, nitric oxide formation. So I definitely think it could be beneficial for the low back. We haven't used it for that, but definitely there could be application for that. The light can provide healing, let body focus on trying to heal more optimally. So that definitely there's way worse options out there for sure.
Yeah. So everything tried, people try it and you never know what works for them. So I'm sure it's been beneficial for some people.
Okay, as it says, improves blood circulation, boosts collagen production, smooths and tightens skin, alleviates joint stiffness, and reduces muscle pain and inflammation. So
there you go.
That's what it says. So
is that's yours? That you using that? Is that work?
I know I haven't opened it yet. So
all right, well, we're gonna have you. We wait for your report back.
No, it's brand new. I haven't opened it yet. I figure I'd ask before I put that on my skin, on my body. So
give it a shot.
Right. All right, sounds good, Karen. Thank you, buddy.
If you don't see me next week,
you know it got you.
You in traction somewhere.
Yeah. No, I'm only joking. So that's it. That's all I have.
All right, buddy. Thank you so much.
Dr. Lenny. Thanks, everyone.
All right. Thank you, man. Appreciate it.
All right. Bianca. Bianca, you there, right?
Yes, I'm here. Hey.
All right.
So one question I have is, how do you get rid of a sty that's inside the eye?
That's inside the eye?
Yes.
Usually it's on, you sure it's not on the edge of the eye as opposed to inside the eye?
No, it was inside the eye.
Inside the eyelid?
Yes.
Okay.
It's not on the lid like a normal sty is. It's actually inside.
Right. It's like right on the inside lining of the eye. Because usually they're like on the end. It may look like it is. It's on like the inside of the lower or upper?
Lower.
Okay.
And
so
it's been about 3.5 weeks and it's starting to go away. But it's not on the lid. No, it's inside. Like if you pull it down, you can see that it was inside.
Right. Right. Okay. Because usually, now was the eye red at all? Was your eye red?
It was red and it was swollen.
Okay.
And
so
the swelling went down because it was swollen. You could tell from the outside. You can see that it was swollen, like the eye was swollen, and then underneath, like where you would like think it was a bag, like you had bags under your eye, but it was actually swollen there.
Yeah, that sounds more like bacteria. Sounds more like bacteria. Sometimes you can watch your hands, put it in your eyes, right? Watch this, jaws and paws, watch your hands, because you can put your hand, you remember, touch your eye and you got it.
Right.
And sometimes that can cause a little pink eye, and that actually is just bacteria. Watch the cross-contamination. Remember, you touch the doorknob and touch your face, you got it. Boom, that fast. So I would start to do a couple of things. I would do eye washes. Number one, get an eye wash. You got an eye wash?
I don't have eye wash, but I know you spoke to
like an eyeglass. You have an eyeglass? Do you have the eyeglass? You know the eyeglass? Yeah, get an eyeglass. Yeah, get an eyeglass, not no plastic. It has to be glass. No plastic. And then you would use I would use a couple things. You can do sort of like warm water. You can use warm water and get it to a temperature that's not hot, but just a good water, like a Crystal Geyser water. It could be room temperature water.
Yep.
Okay.
All right. And just start to flush that way first, just to make sure that, you're getting any particulates, bacteria, anything out of there. I would start to do that because remember, the Crystal Geyser is very alkalizing, number one. So with that being a way of keeping it clean, that's going to alkalize the eye. It'll help that area, but it also will clean out any areas of bacteria, start to clear up the eye. It'll clear up the redness in the eye. Did y'all know that's like the number one thing that clears and makes your eyes, pulls the red out, is the alkalinity of the water? Yep. So that's the number one thing that keeps it clear. So that's one thing. Number two, you can do a couple of solutions. Of course, the Dr. Christopher's Eye Bright, because if it's an infection, that's one of the best things you can do for an infection like pink eye would be the Dr. Christopher's eye formula.
Okay.
Okay, that's the one. Did you ever try that, by the way?
I've never tried that.
Okay, grab that. There is a protocol for that. So you would have to call me and I would have to show you the protocol for how to take that. All right. Because you remember, you're only trying to usually start off with like 2 drops. You don't want to go no farther than 2 drops. Okay.
Okay.
All right.
Now, Dr. Paul, for there's the Eye Bright and the Herbal Eye. The
Right.
Herbal Eye has the. Go ahead.
Right. Yeah, that's a good point, Karen. Thank you. The Dr. Christopher's has the Eye Bright and the Eye Bright formula. Those are the 2. There's 2. See, there's a Eye Bright herbal. There's a herbal. Right. There's an Eye Bright herbal, and then there's an Eye Bright formula. So the formula is going to be the one you want is the formula.
Okay.
Okay, because it's going to have a combination of some things in there. Now, reason why I say call me before then, because it does have a little cayenne pepper in there.
Big time.
Okay, but guess what? It's going to clear that out real.
I know that's right.
good. Yes.
Okay.
It dilates.
So just call you.
Yeah, just give me a call. We'll set up maybe a consult, and I'll show you how once you get it, schedule a phone consult, and I'll help you with that process. All right.
Okay. And then my other question, I have another question. So I scraped my arm, and I mean, it scraped down to like the white meat, and I didn't even feel it. But I want to make sure that it heals properly without leaving like dark scar tissue. Like what should I be putting on it?
Immediately is aloe vera gel. Immediately. Yep. Okay. Aloe vera gel every time. Because remember, aloe vera is the master of derma. That's the master. When I say the master of derma, anything that deals with skin is excellent that's going to be the aloe vera gel. Okay, the actual aloe vera plant, you can take the aloe vera gel, apply it to that area, put a gauze on it for a little bit, let it regain its consistency so that it now starts to scab over. Got it? But that's what's going to help that process correct and heal itself a lot quicker. Just keep that aloe vera gel on there. Yeah.
Okay, and my last one, a friend of mine, she's been dealing with I guess like fungus on her nails. And she said she's taking medication and it's not working, and
fungus ain't going nowhere unless that pH is right.
I know that's right.
See that pH, if you still acidic, that fungus gonna stay right there. Ain't going nowhere. You got to raise the alkalinity of the body, number one. So they'll give people pills and things like that, but it's not going nowhere if the person is still in a state of acid or acidosis. So that means she's got to change her food choices, and she's got to make sure her alkalinity is right with her water. And then when you apply those things, like, things that will deal with fungus, like oregano, not to diagnose treat, cure, prevent disease, just food for the soul, family. Oregano oil, cinnamon oil. Got it? Those are things that deal with fungus.
And she once she gets the other stuff right, she can rub that on her, or just take it in.
No. She can rub it right in that area, right on her nails. Yep.
Okay.
And also watch it, ladies. When you have the special, when you're getting your nails done, did you hear the report on the light? We know when you actually get
that's
your
for that gel.
The gel. The UV light for the gel nail.
The UV lights can cause an infection in those areas, so be careful.
It can cause melanoma as well.
Yep. Yeah. So be careful. All right.
All right. Thank you.
All right. Thank you, Bianca. Appreciate you.
Since you was on the area of the eye, can I jump in with one quick
question right there?
Sure. Sure.
So I've been to Will's Eye, and I was told that I have anemus, and my eye, my situation is on my eyelid. And I'm not sure if I talked to you about this when I seen you, when I had my assessment, but they call it anemus, and they want to do a surgery, which I was kind of very hesitant since my other surgery that I had. So I wanted to get your opinion. Like, do you think that's something I should move forward with, or do you need to see more?
Yeah, I would have to see more on that. Yeah. Yeah, I would say come on in, or let's have a phone conversation first.
Okay.
And I want to ask you a couple more questions about what they're saying, and then what is it that they're saying they want to do? Because you got to make sure it's not invasive, because you got to check everything. And remember, you can always ask for controlled studies with anything that they're actually saying that they want to do for you or with you. And control studies means that, see how those that took this, how was it effective? Was it effective? Was there any recovery period? How was it with someone that was your age, female? Did the people look like you? Was it done here? Was it done here? Because a lot of the studies that are done in other countries, and they're not done here. So I would just say do a little bit of research, but that's what I say. Set up a conference and we'll sit down and we'll go over it. And I'll do some more research for you, okay?
Thank you. Will do.
Okay.
Okay. All right, Haraya.
Can I plead before Haraya? I'm sorry.
Sure,
I just have to say something about the nevus. It was discovered I have a nevus beyond my retina 30 years ago at Will's Eye. They just look at it every year. They have never. It's a mole, just like you have a mole. It's a mole in the eye. And so it's like a birthmark. And they look at it, they study it to make sure it's not rising. They say, oh, if you get, this is cancer, it's the worst cancer. That's been 30 years ago. It's just a spot on my eye.
And you know what? A lot of people have that.
This alarm thing to scare you. And it's sometimes it's just the way it's your melanin, extra melanin in the eye.
See, the problem is it's never been there with me. And I mean, it's been there now for some years, but it just popped up. And my concern is, I hope this don't turn into cancer or anything else. And I I've been through another surgery and I just don't want to have nothing else.
Right. Yeah, that's why I say it's your situation. You got to see, where is it located? Is it worth doing it? All those things. You have to look at all the data, before you do anything invasive, make sure you do all the checkpoints.
Do the research.
Make sure do your research. Yeah. You got to do it. So we got to
talk.
We'll talk it out.
Yeah.
Thank you.
Okay.
All right.
Mr. Sharon, appreciate it.
All right.
Sure.
All right. Who else we got? Big, what do we have in the chat box? Is Prophetess still here?
Yeah, she's there.
Prophetess, where are you, Prophetess?
Look, everything you said, Vegas has got it already in the chat. So don't even start. She ain't miss a thing.
She's flying under the radar.
Yeah, but she's clicking it off. Boy.
Away. She putting all that information in the chat.
Yeah, she is.
Prophetess,
it's going on YouTube as well. So I'm doing double duty.
That's right.
Wow.
Because I'm looking at it on both sides.
So Big B, is that the smoke I see behind her?
Yes, that's exactly right. Smoke. Smoke is coming out of all the countries around their head.
Coming off her fingers.
Yeah, I didn't see any questions in the chat box that people have already asked, and I've answered. There was one about appendectomy. I'm trying to find it. It's very early in the chat.
Yeah, because you were talking about
appendectomy and like two things removed, and they wanted to know what kind of herbs they should take to, I guess, make up for the missing organs.
Yeah, you got to make sure the lymphatic system is moving. You got to really, So it gets into, again, detoxing. We got to get back into detoxing with the lymphatic system. Remember, lymphatic system is a secondary circulatory system, does not have a pump. It only moves when you move. Got it? So you got to get it moving. So we do have herbs that we say that can help to move that even after the procedure, you got to make sure you got to keep it moving. So
Okay.
here's, we use specific herbs, not to diagnose,
Wait,
treat, kill,
Dr.
prevent
Paul.
disease.
I'm sorry, let me give you the question. It says, they had an appendectomy and a gallbladder removed today. What can they take in place of these organ removals?
Yeah. Same thing.
Okay.
Same thing. Good stuff. But it's all going to affect all those things. And it's part of your detox, and you got to cleanse. So that's when we get things that move the lymphatic system, because remember, the gallbladder, liver, all these things work in conjunction for cleaning your blood, but also that lymphatic system sounds like it's slowing down. So herbs that we use would be chaparral, that's CHAPPARRAL, chaparral. Another one would be cleavers, CLEAVERS. You remember the cleavers? I talked to y'all about cleavers. Was the one that if you're out in the woods, it'll cleave right to all of your clothes.
Right.
Sticks to you. Because it really, on the microscopic level, it has like little hooks on the microscopic level. So even when it's inside of your system, it's used for dragging, like a dragnet, pulling that stuff out of your system.
Right.
Got it. Also, you would be, you can do something like a sea moss. Sea moss would be also good for that. And any of the sea vegetables. So chlorella, anything of the kelp, chlorella, purple dulse, all those are good for raising glutathione, and then that'll pull it out also. So those are things that we use.
You know, Dr. Paul, this is Nitha. One thing I just want to say, when she said the person had the gallbladder removed, which is a cholecystectomy, and then the appendix, you know, it's just so ironic. You know, the reason for, they probably gave her a good reason why she needed the gallbladder removed, but she probably didn't have a reason why they removed the appendix. They probably just removed it because they were in there.
Yeah.
Because they do that a lot.
Yeah,
they
that
just take
happens
it
a
out.
lot. That
And
happens.
the appendix is good for your immunity.
That's right. That's the overflow of your toxicity, and it's the reservoir for overflow of toxins. Just like your appendix, your spleen, and your tonsils, all part of that same system.
Same system. Yes.
Same system, y'all. So if you don't have it anymore, you don't have protection in that area. That means you got to keep it moving now. You got to get it moving. So that means things like the herbs that I just mentioned are used for cleansing that lymphatic system. Cleavers is a really good one for women, though. Let me tell you, that's very, very good. Cleavers. Okay, cleavers, and of course the chaparral. Okay.
Okay.
All right.
Dr. Paul, just hold on to
before you go there, Big B. Prophetess, I did want to step over to you, and I wanted for you to tell the family about tomorrow at the Eagle's Nest. We are going to be doing a Zoom tomorrow on the Eagle's Nest, and you can join us tomorrow for that. Do you have information that you can present?
It's already in the chat, Dr. P.
No, it's in the chat box.
Yes.
I will produce it again because Dr. Paul will be with us. It's going to be a much smaller class unless all of you all come over. And for everybody who did not get a chance to ask a question, you will be able to join us tomorrow, Thursday. I should know my own website, our own numbers by heart. You can this on Zoom. The number is 455-973-2821. 455-973-2821 at 7:30. You'll be able to get much more close, in-depth personal time, because the class will not be as big as the family tree. And like I said, let's all come. But we will be there from 7:30 until about 9. I think we're finished.
Profit is 455 what? 873?
455-973-2821. And I will put it back in the chat box.
Yeah, because it's in there, but just redo it again.
And the Eagle Nest is where everything started. That's where the
It
men's
all
gathering.
started.
That's where
That's
it
right.
all started. Reverend Ricky Halsley and Pastor,
Teresa
we think about so many good memories of you know, the Eagle's Nest, when we used to have the sets with the men. And then, you know, we used to have the breakouts too with the big room. You know, we bring everybody out there. Big B, you took pictures and everything.
All the video.
I missed those times, and you know, so we're gonna do it on Zoom this time. All right. So Pastor Teresa Halsley, Reverend Ricky Halsley, you know, come on out tomorrow evening, get that information, join us. All right. We love that. We love to have you. All right.
Is that going to be recorded for those who are out of state and might want to see it later?
Yeah, that's a good question. Prophetess, you know if Joey's gonna be is he gonna record that?
I don't know, but I will ask tomorrow. If it will be recorded.
All you gotta do is all he has to do is hit a button.
All right. All right, good stuff, y'all. Good stuff.
All right, Dr. Paul, just before we go to Horizon, one question I thought you should want to talk about. I feel like a horrible mom, okay? My son is circumcised and received vitamin K and Hep B, a shot when he was born. I had a healthy pregnancy and really didn't want him to have it. I regret it. What does the Bible say about circumcised? He went to his baby visit for shots, but didn't have the polio one. What word can I say? What word can I say? I guess to have
with circumcision, you mean?
Yes.
Well, that's a spiritual decision. You know, whatever you decide to do, that's something that's considered a spiritual thing.
Right.
Some will say that it's also a cleanliness because the foreskin is pulled back, which actually allows now for not bacteria to get infected around that area. That was the whole concept of circumcision.
Right.
Was that it was not going to get infected, because once the foreskin goes over, it can get trapped in there and it's unclean. So that's the whole point behind that. Now that's also a spiritual, that may be a spiritual, decision that usually doctors will ask, when your child has, been born, and, and then they'll make that as a decision. Now, just have to keep it clean. That's all. That's the main thing. Now, you mentioned also hepatitis. What was that? The hepatitis?
Hep B, yes.
So did she say, I didn't get that last part. What was it that she was saying about the hep?
Hold on, I scrolled down.
They had the shot.
I think she did not get delivery. One particular shot.
Yeah.
They did not get, or they did get the shot.
Hold on, Dr. P. I'll find you.
Okay, and number one, how old is the child? How old?
Sound like it's a newborn.
That's what it sounds like. Sounds like a newborn.
Yeah.
They routinely give those shots, vitamin K and the Hep B.
Hep B.
Right. So I mean, it's
without permission.
Yeah.
Without permission.
It's a part of the routine care that they give neonates. That's why obstetricians. That's why obstetricians need to have those discussions with the patients before they deliver.
Yeah, but that's not correct. See, remember, you have the ability to refuse the right for anything. You are autonomous. You don't have the right to put something in someone without their consent. So that's a problem. So
and her concern really was that she doesn't want DHS to take a baby from her because I guess she didn't get the last shot.
Yeah, but that's not the point there. You remember, there's a website, number one, I would suggest you go to. It's called Vaccination Liberation. Got it? I would go there to check out, to understand, number one, what's going on. I'm hearing a couple of things that don't sound quite right. But when you have, just like with children, you have the ability to option out. Got it? You got to know how to option out. So that means you have the right to actually say, for whatever reason, if it can be spiritual, like for example, my son Jaron never had a shot. Never had a shot.
Right.
Never had it. Nope. So a lot of people have it. You can option out. See, as a part of the United Nations, here's the thing. At the United Nations, I sit on the floor of the UN. That's part of what my job is, that I report, and back we do what's called a quadrennial reports on all the things that I see, whether in here or on the radio, or things that I see in person. And we report back to them the findings that we have. So I'm a consultant to the United Nations when it comes to that. Well, one is that when I was researching this, we have an Indigenous Peoples Act. Got it? And that was designed by the UN that said that people have the right to live their quality of religion no matter what. So you can't make them take a shot. They can option out for religious exemption. Got it? But it is based on what you declare your position. The problem is people don't declare your position. Got it? Yeah, they'll say your child is going to get kicked out of school and they can't do this. But that's not the case if you declare your position. If you declare your position, you can say we choose to opt out. And that's all you have to do. Because here's the point. For religious exemption, it is said, even in the document, it says, if you break the if you pierce the skin, you just increase the chances for infection. So now you just defiled the temple. So that person's religion is now defiled. They're considered defiled or unclean. That's exactly what's in the writing. So what do you have to do? You have to do something. You have to declare your position. Go to that website, and I believe it's vaclib.org.
That's it.
Yes, that's it.
Okay, vaclib.org. And you can get a lot of that information. There's plenty of people there that can help you with that process. I had to school many nurses.
I'm sure you did.
I had to school many of them. I remember one said, I sent it in and I knew I was going to get a call. I just knew it. I said, I'm going to get a call on this one.
But Dr. Paul, for the pregnant patient, everybody who has a friend who's pregnant, a family member who's thinking about becoming pregnant, you need to tell them these are things that they need to discuss with their obstetrician. They need to bring them up, because most obstetricians, unlike me, won't bring those things up. If they're concerned about things that deal with their pediatrician, if you know who your pediatrician is going to be, make an appointment and go have these discussions with your pediatrician before the child is delivered.
Yes.
Because
Amen.
once the child is delivered and they take the child to the nursery, they're going to give that baby all the shots, do all the tests that they routinely do. Mama will find out about it after the fact. She can't do anything at that point.
Yeah, well, that's being more informed about your situation, period.
Right.
You know,
Right.
when you having someone that's going and overriding your ability for you to do things and make decisions and just give your child a shot, that's not right. That's incorrect.
not right.
That's not correct. You can't do that. You can't do that. And if they did that, I ain't trying to start nothing, but
hey, but I will.
Well, well.
Yeah,
it's a scare tactic. It's a scare tactic that they use for the public, because I know plenty of people. My nephew has not had a shot at all. My grandchildren, no vaccines at all. And they go to school because you can go to school. It's a scare tactic.
Yep.
Yeah, it's a scare tactic. But remember, here's the key. Here's the key. Remember now, the key is you have to declare your position. If you don't use that declaration, then they can do whatever they want. They say, "Oh, your child's gonna get kicked out." Oh, yeah. You're gonna have to. I remember as an example, the nurse came to me and she says, well, I think I'm gonna allow this. I said, no, it ain't about you thinking about it. I said, my declaration. And I had to explain to her that no, this is my right. And she was like, I don't understand what you mean. I said, you can't give and force somebody to take the shot. I said, this is our religious exemption. And then she says, well, what do you mean by religious exemption? Because they don't get this thing. They're never even trained.
Right, never trained in all that.
So that's why I said, I'm declaring my position. And she says, all right, well, if anything happens at the school and anything breaks out, you're going to be the first one I call. I said, great. I said, yes, that's great. And he can't come back if there's something that breaks out. he can't come back until it's gone. I said, great.
That's right.
He's at home and healthy then at that point.
I said, both of those are great with me. And then
Right.
she realized what she was saying. And then she says, wow, nobody's ever told me this. And I
Mhm.
said, yes, it's part of your declaration. You
Right.
got it?
Mhm.
And then she was a school nurse. And that school nurse had no idea. She said, I've never even seen this before.
Yep,
She's
I
never
can
seen
believe
it
that.
before.
Can definitely believe that.
So just understand that. Go to that website. You can learn more about it. But also there's documents on there. There's letters you can provide, even for employers, military, anything you want, you're involved with.
Yes.
You can just go right to that website and it'll help you out. Okay.
Okay. All right, Dr. Paul, we've got two, and we'll be a little bit after 9. Haraya and then Margaret. Haraya.
Yes, good evening, family. How's everybody?
Fine.
Hey, Araya. I saw you on Facebook.
Oh, you saw
with your grands. I saw you running out at the what was that? Penn's Landing.
Oh, you saw me. Okay.
Yeah.
I wanted to mention that, Dr. Paul, you got me feeling so good. I'm getting out and walking around, although I did misbehave a little bit because I had to get my chicken wings.
Well, I won't pray for you, Haraya.
All right.
I'm working on it, you know, but the thing about it, I feel very good. And I started doubling up on the colon cleanse, and everything is beautiful, you know, like and the stomach is flat. The stomach was sitting out, like I still had all 10 of the kids sitting in there, you know, and now it's flat a little bit, you know, so you know,
go ahead now. Go
ahead.
Let's
There's
stop
another one of
Stop
those stealth.
there.
That's one of those stealth ones, Dr.
Mama, come in, man. Let's give her. Come on.
Yeah, all right. That's what's up. Terrific. Congratulations, girl.
Congratulations.
That's right. That's all right.
Congratulations.
I'm breathing really good. I used to have to,
Congratulations.
You know, one of those beds where you use the remote to you know, one of them beds you can go up with the head piece and the feet and everything. But I used to have to sit up in the bed. I can lay down flat now. I'm breathing. And then through that, when we went through that smoke thing last week, you know, I survived it. I closed my windows and turned the fan on inside the house. I was okay. So I'm just thanking God. I'm just thanking God. I ran into you and started listening to you. I got my green drink that I drink every morning. And I am taking the, you know, the different herbs and everything. I still got to get over there to come see you because I really want to know the condition of my system. Yes. I had a very large growth on my neck with my thyroid, but even that has gone down. But I mean, it's still there. But it was noticeably sitting out. And it has gone down. So I'm just
awesome. Awesome.
Awesome. Yes. Congratulations.
Yes, you keep it up, Harai.
Yes.
Let's give her a hand one more time, y'all. Let's give her some love.
Yes. Make all the difference in the world.
Thank you.
Wonderful. Yes.
Wonderful. When you gonna get testimonies like this, man? People firing up, man.
All these flutes.
Awesome. This is
Thank
awesome.
Thank you, family. I forgive all of y'all for putting me on the back of the bus, one call after the other. We'll get to a riot in a minute.
Listen, you better stop that. That's how you just hang on in there.
but here's the thing. I wanted to ask in reference to growing the food and everything, because back in the day when I was really on my vegetarian trip, I used to make compost, and I'm just wondering, when you have some good soil and then you put your layer of vegetables in there, and you know, I would be careful not to put any vegetables in that have pesticides on them. But are you and then you put the other layer of soil, and I used to put worms in it. I used to put worms in it because the worms would mix the compost together. So can you use that exclusively to grow your products in? I mean, like when you're putting that layer of vegetable leftovers in there.
I know what you
are you actually making soil?
Yeah, yeah. You remember like you said, there is a concern if it's conventional that you got these pesticide sprays on there and you're making compost that's a cross contamination issue. So yes, that is an issue. I mean, that's something that many people aren't thinking about because they think, of course, compost is compost. It's broken down. It's just, it becomes fertilizer. But what you're talking now brings a whole nother part of the equation. Is this going to be pesticide? That glyphosate is dangerous. The chlorpyrifos, that's the other one. That's a very dangerous thing. These are sprays and stuff that they're putting on there. Yeah. And yes, that's why we got to start doing our own thing, y'all. We got to start doing it.
I know that God is going to move you to be successful with this venture, and I hope that we reach out to people that's in the islands that are the Caribbean islands that are close by, because they have I think a more pure environment, and we can start importing. We're going to be successful with that.
Yes,
but another one of my concerns, I'm just getting some thoughts from with all of this free food giveaway. I just feel like we're getting ready to go into a passage where they're going to be closing down the supermarkets, because the supermarkets are not going to be able to survive with all this free food. And I mean, they are giving it out everywhere, and I'm just thinking we're coming into a time where supermarkets are going to be closing down and food is going to be scarce. And I wanted, my last question is, what is your thoughts on preserves? I know they use glass jars, but how long can you preserve, and is that a good way to go?
I would start moving into and I gave out this, we did a whole survival series, get prepared, grab bag series, where I talked about everything that you should put in your grab bag, including like a crank radio, walkie-talkies, things like that. You want to put all those things in there. And there are companies that you can buy food that stores for many years, and that's organic. You remember we gave that out? Let me see here. This is what I read.
Yes, it was a while ago.
Patriot. They got it at Costco's.
Uh-huh.
Not the Costco one. Patriot.
Patriot.
Patriot Supply.
Mhm.
Patriot Supply was one of them. They were a little high on that side, but there's a lot of them that are out here. Let me show you what this is, okay? If y'all want to take a picture of this, you can take a picture of this. Okay, here's one. These are kits that I would say I got a few of these. I'm just going to let y'all know. I got a few of them, and you should all get some too, because it's a survival kit that you want to always be prepared, that can last you a long time. See it? Can you see it?
No, I don't see it.
Let me see here. Let me see if I can share this right here. Oh, that's the wrong side. Let's see here. Let me see if this one here. Let me see. Patriot Supply. Here it is right here.
There you go.
When you can see it.
Yep, that's it.
Got it?
Yep.
Now, look at this. This good for 25-year survival food kit.
What?
Yep.
You got it? Yes. And these are the different things that are in here. Now, there are other ones that are out there that are non-GMO. There's ones that are organic, and you can go through all of these. This is just one of the many sites that are out there. And this is for Patriots. And this 24 delicious recipes and disaster-resistant pouches, all on an easy payment plan. They'll do payment plans. They do all those things. But there are survival food kits. So all you got to do is punch in survival food kits. And some of them, you'll get big containers worth, and you can get up to a year, 2, 3 years of just sitting there, and they last for 25 years. And each one, you just add water to them. Usually you'd add water. They're very easily to start. They've been specifically designed for situations like this. You know,
Are they
when you're
organic?
concerned. Yep, there are some that are organic. That's correct.
Yeah,
How about
I had
vegan?
I heard someone talking one time when the Native Americans were on around, and I'm part Cherokee myself, but they were on around Thanksgiving time, and they were telling how the Native Americans used to have food stores, because they would migrate once it got too cold in one part, they would migrate to another part, but they would leave food stores and and carefully packed in the ground and stuff like that, So I know that we have survival tactics. This is very powerful. This is very good to know.
Yeah, here's
25
one.
years supply.
Let me give you another one here. Here's another one. All right, let me give you another one. This is some of them that are coming to mind. Y'all need to be taking pictures and stuff, y'all.
Any vegan ones?
I'm sure they are. I'm sure they are. Yeah, I'm sure they're out there. Yeah, I'm sure they're out there. All right, let me grab this here, Big B. And we can close out in a second, okay? That's one. I think this is really important here. All right, let me know when y'all see this, okay?
There you go.
Yes.
Okay, see right here? They got one right here. You got all this stuff, sample packs. You got water. You got heirloom seeds. They got water filters. This is one site called Numana. And this is considered organic right here. This is one of the organic sites that you can actually buy organic. See right there, organic survival food. 25 plus years.
Spell that, please, for the people on the phone. Can you spell
Sure.
the name of that website, please?
Sure. Numana is spelled NUM as in Mary, ANNA.com. You got it? And they're organic survival foods. And of course, here they are, some of the certifications, 25 plus years, GMO free, no added preservatives, things like that. So you can see they have a lot of different things. So you can go through it and, there's a lot out there, y'all. A lot of people are on board with this and they're not trusting the markets and things like that. And just like you kind of always feel like something is like the shoe about to drop. Like, with the water situation, like the water situation that happened when they hit everybody with the alert. And then again, this Monday, West Philadelphia, got another alert, that they had to boil their water. I just thought that was interesting that West Philadelphia, they didn't get some kind of emergency alert on that.
Emergency notice.
It was interesting how they didn't give one on that one. I think
I'm not trying to be a conspiracy theorist, but when that I-95 burnt down, and then my daughter, knowing that I am a paranoid nut, says, "Yeah, mommy, they're closing off all the ways to get out of the city." But it was
that did come up. Yeah, I can imagine. Yeah, people were thinking about that, but that was a brother that really just, he had a bad accident. It was a bad accident.
May God rest his soul.
Yeah, rest his soul. Yep. But that's what I wanted to share with your family. Get your emergency supplies. And they have kits and specials that you can buy that actually have water kits. They even have blankets and things. Now, here's one that people don't think about. If they're talking about the El Nino, I don't know if you heard about the latest report from the Farmer's Almanac that came out last week. And it said that El Nino is going to be back this year.
Yeah.
Did you hear about that?
Yes.
So El Nino, when it comes through, you remember the jet stream rolls right through Pennsylvania. So that means they're expecting a heavy snow this winter. And that usually when that jet stream dips down, that's right down us. See, last year it was up top, remember?
Yeah, we missed a lot.
Everything went straight over top of us. But now it's dipping right down through Pennsylvania. So they're already saying, what happens if you have no power and you don't have any heat? Then they have these blankets that you can actually, maybe I'll bring it on next week. It's these blankets that you put on, and they actually are for like if you are like hiking up in the mountains, and people when they go and climbing up like Kilimanjaro and all those things, they use these special type of blankets, and you can get them, and they come in a roll about this big, and you unroll them, and it takes your own heat and heats you up with it. So it's very inexpensive. It's about a roll like that. So maybe I'll have that information for you next week. All right.
Yep.
And we can talk about that. But get your walkies. I would get a walkie-talkie. How many of y'all have a walkie-talkie with you? You got a walkie-talkie?
Yeah.
Yes.
You got a walkie-talkie. Keep one in your car and give one to the family. So if the phones go down, you ain't gonna have no phone. Okay. Your only thing's going to be available is going to be a walkie-talkie. So keep those walkies with you, okay?
Okay. All right, Dr. Let's get Margaret in here. That should be it for the night, brother.
Hey,
So-
Margaret. Okay. Margaret,
Margaret.
you just
There you
gonna
go.
dance us out, right? You dancing us out. Is that what
Oh,
you're doing?
sure. No, I'll do that too. But can you guys hear me?
Yeah, we can.
Yeah, we can hear you.
Okay, because I have you on another speaker, so connected to my computer. So my comment is in regards to I was watching Lester Holt on World News tonight, and it was on at comes on at 6:30, and I just caught the end of it, and I was wondering, have you heard about this? And I remember in a previous episode on here, on the family tree, you mentioned that there was going to be more and more vaccines for all different things now. And when I saw this episode tonight, I thought about, oh my gosh, you already talked about it, and in the sense that that's what's happening. So it's a vaccine, ironically, in regards to helping fight brain cancer. Did anybody hear about that on the news tonight?
Yeah, you're gonna see all the different ones coming through. Yeah, you're gonna see a lot of them coming through, and they're going to be driven by the concepts of putting mRNA in most of them.
Yes,
So
that's correct.
That's been the goal.
Yep.
The goal is to do that. So they even talked about flu shots also, putting mRNA in flu shots.
Dr. Paul, you can pull up the how on the on your computer or whatever, your phone, you can pull up, just type in vaccine for brain cancer, and the NBC News will come right up, and you can actually listen to. It was only like about a 2-minute report, but the interesting thing about it was how they're like raving about it already, because they're already starting to use it on people, and they claim that it's going to add so many more years to your life. Like they talked about some person that had the vaccine, and they were only expected to live like a year, 6 months to a year, and they're still surviving. It's been 4 years, and they're healthy. And I was like, this is how they're going to really push this stuff now. And I was like, you already forewarned us about it. So
you're going to see a little bit of everything coming your way.
Right. Exactly.
And that's why it's important for you to take care of yourself, family. Know where you are at all times. Make sure you're checking yourself regularly. That's why we do the things that we do here on the family tree. So we talk about how your temple is what? The temple is the Holy Spirit. That's it. That's the temple that houses your Holy Spirit. That's your essence of who you are.
Yep.
So you have to make sure that you keep your temple clean. That's all that is required.
Very easy.
If you start to keep your temple clean, it takes care of itself. That means put life in it and you will get life. You put death in it and it will show you death.
I know that's right.
It's as simple as that.
I know that's right.
There's nothing new under the sun, y'all.
Yep. Yes, sir. Yes, sir.
No new technology. There's nothing great. Nothing past that. There's nothing no scientific and
so very true.
They try to beat God at his game. You can't beat God at his game. That's just it. You got
That's right.
So thanks for mucking out, Margaret. Thank you so much. Appreciate you.
All right,
Thank
man.
you.
Listen, we are there. We're kind of wrap up now, and so we can get out of here, and we'll see you again over the weekend. How about that? Or maybe not.
I gotta go.
I want to say definitely to all the men out there, happy Father's Day to you.
Yeah.
All right.
That's right, guys. Hey guys, listen, just remember, in order to get a copy of tonight's chat, all right, send an email to meccavideo@gmail.com. Again, that's meccavideo@gmail.com. And to continue to support the Family Tree, guys, use my Cash App. That's $ Bill Morgan, $ BILMORGAN. If you use the bank through Zelle, that's Dr. Paul at drpaulherb.com. And you can also send out information to our P.O. Box. And that's P.O. Box 191, Mullica Hill, New Jersey, 08062. Hey, what I say, bring the family, bring the enemy, bring the frenemy, bring everybody to the Family Tree every Wednesday night. Hey, this is what's up. Happy Father's Day, guys. And guess what? Happy Mother's Day, Super Joe. What up for you all? We waiting to be here. So I appreciate that.
Good one, Big B.
Yeah,
All
buddy.
right, let's give Big B a hand over
Yeah. That's what's up. Hey.
And also, I'm going to give a shout out to thank Prophetess over there. I think
Yes,
she had
always.
her own- Is she still here? She's still here?
Yes.
Okay, if she's still here, let's get
Prophetess.
Prophetess.
She keeps us on track.
She keeps us on track.
Yes.
5 fingers, yeah.
Yeah.
I saw smoke today. Big B,
She's bounced already, Dr. P. But
Yes, and also I just want to say, join us tomorrow. We will be with the Eagles Nest family. So if
Right.
you want to chime in, or if you have someone that couldn't meet us tonight, meet us tomorrow 7:30, and that's on the Zoom call with the Eagles Nest Development and Christian Center. All right.
Yeah. I want to thank
All
again
right.
Dr. Lenny for hanging with us tonight,
Yes,
Dr.
thanks,
Paul.
Dr. Lenny.
Yes,
for
sir.
hanging with us. Hey.
Yeah.
I want to give a big shout out for all the testimonies.
Yes.
Give them one big old shout out.
All the sleuths to come in. Yes.
All
It's
of
your
them.
testimonies that help make us who we are.
Continue to do what you're doing. Stay on the path. When we say keep it on moving, right? Be encouraged, because remember, if you're breathing,
Yeah,
you
got a shot.
shot.
Yeah. Hey.
Happy Father's Day. Happy
Yeah. Thank you, family.
Dr. Laila. All right. And also, if you want to, members, last got Dr. C. assessment. We got a 3 days.
All right.
But in addition to that, I'm adding to the additional curriculum. It's a great gift for someone for Father's Day. I've got stuff coming in here. I don't know where that came from. All right. I got noise. I got my dog over here. He's snoring.
Yeah. All right, buddy.
All right, I wanna
Take
thank
care of
you.
yourself, man.
Tap it out.
Don't forget our tap in.
That's the tap time.
Tap it out.
Tap it out.
Tap it out. Tap it out. Tap it out. Tap it out. Tap it out. Tap it out. Tap it out. Come on
Yeah.
down. Come on down.
Yeah.
Come on down. Oh, yeah, that's nice smooth music there. All right.
Yeah.
Come on down. Also, we do have another event that's taking place. This Eloise, I forgot Eloise.
Yeah, that's right. Eloise, she's still here somewhere. I think she's still around. I think so.
Is she still here? They're having a major event this Saturday. All right.
Yeah.
This Saturday, right at Old York Road, right out there off of Old York. I don't have the address. Oh, Eloise. Here. Was she in there today?
Yeah, she was. She was here.
Oh,
She was here.
all right. Support her. Give her a call. I know y'all have her number. I don't have her number.
If somebody has the number, put it in the chat, and I'll make sure that you get it. All right? In the email.
Hey, Kamara, can you put her number in the chat for us?
All right. Appreciate that, Kamara.
All right. Thank you so much. All right. Tap, tap, tap. Tap, tap, tap. Tap, tap, tap. Come on
Yeah.
down. And breathe. And breathe. And breathe. Shout out to my cousin Ronnie. Shout
Yeah,
out to
buddy.
California. All right. We all over the world, man. We all over the world.
That's what it makes. That's when it happens. That'll get it, Monica.
Tap, tap, tap. Tap, tap, tap. Tap, tap, tap. Good. Good.
Yeah.
Come on down, left and right. What's on the left side? What's on the right side? Come on, Marcy. I see you. I see you, Marcy. All right, liver and the gallbladder. What's on the other side? The other right side. The pancreas, right. There you go. Good, good, good. I want you to take go up and breathe out. Breathe in. Breathe out. In. Breathe out. In. Breathe out. Good. Good. Perfect music, right?
Yeah.
Breathe out.
All right, breathe out.
Real good. Take your hands
All right.
out. Lock your hands in lock. Turn them upside down.
Have a great weekend event. That's what's up.
And stretch. Stretch. And stretch. And stretch.
Good night, Brenda.
And stretch. Good. Hold it.
Hold it.
Hold it. And lean.
All right, Connie.
Margaret dancing will be doing this. She can't stop. Other side. Lean.
Yeah.
Lean. Good. And bring them forward.
Yeah.
And the next thing, 1, 2, 3, I want you to pull. So 1, 2, 3, and pull. And breathe. Feel the outside of the shoulder. Pull, and release. Good. Coming up.
Yeah. Hey.
All right, good. Keep it up. Rub them together. Do your last energy bath. Just in case you didn't take a bath today.
Hallelujah. Yeah.
Because this is all your energy, right?
That's right.
Take that and you put it over your body like this and just breathe in and breathe out. Good. Wipe it on down. Bring it on down. Good. Come on down. Come on, one more. Good. That's your energy right there. Feel that heat in your hands?
All right.
Good. Bring it on down.
Yeah.
Positive energy.
Salve Zambi, o guerreiro da paz.
One more time.
Defende
These
essa
energy
mata,
baths
manda
are good.
cantar.
Take all that good energy.
Yeah.
Caboclo prisioneiro com seu bamboleio que louva reinar.
And stop. And rotate the top one. Feel the bottom. Feel that ball.
Yeah.
That's your energy right there. Bless y'all. May God keep y'all.
Yeah. Good night, everybody.
All right. So did you get her number in the chat? Did you get her number? All right, we'll get her number in there.
Yeah, make sure you get it in there.
Email blast. All right.
Yeah. All right, great. Thank you, Kumar.
All right,
Appreciate you.
Appreciate y'all. Look at dance out there. Look at
Hey.
Margaret. All right.
Thank you, Cricket.
All right.
Yeah. Yeah.
Hey, President James, what's going on? Hey. Rosetta, what's happening?
Happy Father's Day.
What's going on?
Yeah.
Looking like a scientist over there.
All right. Yeah.
Don't mess with her. She's bad girl over there. Karen with the arsenal. Karen got the arsenal back there. She got the arsenal.
That girl's a hero be playing.
Don't come over here now.
Wow.
I'm ready for you. I got you now.
Yeah, buddy.
Whatever
Yeah, buddy.
it is, I got it. B. Go ahead, Big B. Big B. Go Big B. Big B. Go Big B. Go Big B. Go Big B. Shout out to Reese. Big B's grandson graduating.
Yeah.
Shout out.
That's right. Yeah. Yeah, it's in there, Dr. Paul.
All right.
Eloise Prescott.
All right.
267-240-5109. All
We
right.
gotta count down because I gotta see y'all later. Indy's already begging me for a bone right now.
All right, boss. Have a great ride.
He's pulling on my leg, Big B.
He said, come on, I gotta go.
Come here, Indy.
Indy says,
Come here, Indy.
Indy said, I do what I want to do.
Come here.
There he is.
Come here and make your appearance, Indy. Come on, Indy. Come here.
Indy said, who you think you are, the boss? I do what I want to do. Don't you fall out that chair.
Yep. He said it's time to eat, Doc. Come
I know
on,
that's
get
right.
out of here.
All right, Bishop.
All right, we'll see you later. See you on the weekend, family.
Yeah.
7, 6, 5,
Yeah.
4, 3, 2, 1.
Good night. All right, Dr. P. See you, buddy. Hey.
Love y'all.
All right, man. Blessings.
God bless y'all.
Yes, sir.
All right. Oh, I like that one.
Nice.
Oh man, I can't let this go, man. I'm not understanding.
Uh-huh.